Hello everyone and welcome to my channel. My name is Maria and on my channel I create videos around everything nursing. I also have a handful of lifestyle content. I'm trying to get to 10k subscribers, so I'd really appreciate it if you guys subscribe to my channel and also if you gave this video a like. Not only does it help with the growth of my channel, it also tells YouTube that you guys would like to see more videos like this. So as you've seen from the title of this video is going to be a nursing dilemma, which I'm super excited to do. I do remember the first ever nursing dilemma I did. I think I was doing like the nursing degree versus the nursing apprenticeship program. So if you are interested in that, then make sure you check that out. But in this video, I'm actually going to be talking about a situation that I was actually sent to on Instagram. So if you do want to submit your nursing dilemmas, then make sure you head over to my Instagram. In this dilemma, I believe it was a girl. She messaged me on Instagram saying that I believe she said she was a second year nursing student, and she had like a feeling that her mentor was gonna fail her on her placement. And she said that she's really been struggling with her confidence, and she feels that the confidence is basically along the lines of that she feels that her confidence is having a negative impact on her ability to perform at placement. And then she also asked for a couple of tips on how to increase her confidence, and then, you know, how to kind of like approach her mentor on, you know, if she was going to fail or not. So first thing is first, like, this is a tricky situation. Luckily for me, I've never been in a situation where I felt that I was going to fail my placement. So if you're in a situation where you feel you're going to fail your placement, or if your, you know, situation was kind of like mine where you never had the feeling, make sure you still watch this video, because I am going to give you some pointers on what you should do for this particular student nurse, and also what you should do, you know, moving forward from it, so you reduce the chances of you finding yourself in a situation that this student nurse has found herself in. And if I was ever in a situation where I felt like my mentor was going to fail me, the first thing I would actually do is, at the soonest and the most appropriate occasion, I would go to my mentor and say, if you had to pass or fail me now, would you pass me, would you fail me, and why? And let them explain. And then also the second question I would also ask them as well is that, what areas of my nursing practice do you think I'm excelling in, if any, and what areas do you think I have room for improvement? From that point forward, I would set learning points for myself privately, and then with my mentor I would also set learning points, or more importantly, action points with myself and with my mentor. And I would always make sure that I documented everything. At my university, when I was a nursing student, we had a portfolio, an online portfolio, and it was called PebblePad. And any meeting that you had with any of your mentors or anyone in relation to your placement, then you would document it all on PebblePad. So I'd make sure that I would do the same thing if I was in your situation. Just based on some of the nursing students that I've come across since being a registered nurse. I've been a registered nurse for just over 2 years now. I don't think that this point is really emphasized in terms of documentation. When people think of documentation, they just think of documentation in terms of what you do for the patient, but also when it comes to your learning, make sure you stay on top of it. Make sure you stay on top of the documentation, especially when you're at nursing school, because I don't want to say it's like a life or death situation, because it really isn't that serious, but it really could be the difference between, you know, this and this and this and this. You know, you yourself know how important it is for you. I remember when I was a student nurse in my first year, our placement supervisor, so we had like a placement supervisor, they basically liaised with our placement, our mentors and us, you know, if we were having any issues or if we wanted to highlight any concerns, any queries. That's what the placement supervisor did. And then obviously we had our placement mentors. And my first placement supervisor, she always emphasized the point of making sure you document everything. That way, if anything ever happens, you've got a leg to stand on. Because just imagine if, you know, your mentor did fail you and you believe that they didn't have appropriate grounds to fail you, but you don't have any like documentation or any evidence to back it up. How are you then gonna appeal the decision that they made, or how are you going to support your appeal to the decision that they made? For nursing students who feel that they may fail their placement, even for nursing students who are fine with their placements, always make sure you schedule regular interviews or regular meetings with your mentors. Throughout all of my placements, I made sure I had at least 3 meetings with my mentor. One was earlier on, one was in the middle, and then one was probably, you know, 2 or 3 weeks before that placement was to finish. And these 3 meetings didn't include the initial meeting and the final meeting. So when you first start your placement, you'll meet with your mentor. They'll tell you this, they'll tell you that. All of that's the induction stuff. I don't really consider that as a meeting because really they don't really know where you're at, and you don't really know where you're at yourself, and you don't really know where your placement is at in terms of what they can offer you. So yeah, making sure you have regular meetings. Another thing that I want to mention as well is that one thing that I did when I was a student nurse that I know a lot of you guys will find very beneficial. As part of my nursing school, at the end of every placement, your mentor had to sign off, our mentors had to sign off like maybe like 50 to 100 competencies to say that we had met them. And I'd learned from the mistakes that other nursing students made, and I made sure I didn't make the same mistake. There was one lady in my cohort, well, I'd made the same mistake, but it never ended up the way that she did. I never ended up in a situation that she ended up in. But basically what had happened, we'd both gone through our placements, and in a final meeting, sat down with our mentors, can you sign off for the competencies? My mentor was fine, you know, I'd met all the competencies, she signed it all off. My colleague, on the other hand, final meeting, mentor, can you sign up all the competencies? Her mentor's then like, I don't remember you doing this. I don't actually think you've done this. So many of her competencies didn't get signed off, even though she knows that she had met those competencies, whether it was with her main mentor or her co-mentor or another nurse on the ward. So what we then started to do, what we all told ourselves was that rather than wait until the final meeting to have all of our competencies met off, to have all of our competencies signed off, in the first meeting, in the middle meeting, at any point during our placements, we would ask our mentors to sign off some of our competencies. I remember when I was in A&E, my final placement, we had a lot of competencies that had to be signed off. So I'm thinking, I'm not waiting until the end of this placement before I'll say, can you sign off my competencies? There were some shifts on a night shift. On A&E, I'm sure if you've had a placement on A&E, you know what it's like. You can have like 3-4 hours with absolutely no patients, and then you can have 3-4 hours where it's actually chock-a-block, like proper busy. So on the times, during the times where it wasn't as busy, I'd be like, mentor, hey, I know this placement doesn't finish until 3-4 months down the line, but can we go through some of the competencies that we can agree on that I've already met, and then going forward we know that these are the competencies that I haven't met. So that's what you guys should do from early on. That way you're not at the end of your placement and your mentor's like, oh, actually I haven't seen you done that. Oh, actually, I can't remember if you've done it or not. Because at the end of the day, your mentor is trying to protect their pin as well. Because imagine if they sign you off and say, actually, you know, so-and-so has met all of these competencies, and then you go over into your next placement, and then you make like a massive error or like a massive mistake, and your mentor's like, how on earth, your mentor for your next placement is like, how on earth did you achieve these competencies? They're going to look back and be like, hey, but this nurse said you've done it. So yeah, make sure you're having regular meetings with your mentor. Meetings where you're sat down, not meetings where you're kind of running around. And no, you need to be sat down. Even if it's just like 10 minutes and you've got your portfolio in front of you, make sure you have all of that in front of you. And make sure you do bits as you go along. One advice that I want to give to this particular student, like I've said, I'd ask 2 questions. Would you fail or pass me now, and why? What areas you think I'm excelling in, and what areas you think need room for practice. And like I said, I'd also make learning points by myself, and I'd also make learning points and action points with my mentor so we can work on them together. One thing that is very, very important when it comes to your placements and making sure that you don't fail it, like I want to say, if you're going to fail it, you're going to fail it. Not everybody's going to pass their placement, because some people just aren't cut out for it. I know it sounds rude, it sounds mean, but let's just be real. Not everybody's going to, you know, jump over all the hurdles that you need to jump over. But one tip that I want to give, you know, to this particular student nurse and to other student nurses is to make your mentors involved in your learning. Make them, I don't want to say make them, like you must be involved, you must engage in my learning, but make sure that they're an active part of your learning. Make sure that they know what is going on. You know, every so often say, this is what I want to work on. There's nothing wrong with saying, oh, this is an essay that I'm doing at not work. This is an essay that I'm doing at university. This is what the emphasis is on, even though it might not be directly related to your learning. Just making sure that you're engaging with them, because At the end of the day, they're the ones that are signing you off saying that you've met the competencies. They need to know who you are, not just like on a personal level, but on a professional level. They need to know who you are, because think about it, student nurses, you come in, when a student nurse comes in for placement, one of the first things I always ask them is like, you know, what year are you in? They'll say second year, but there's levels to second year. You might have had your first, this might be your first ever second year placement, or it might be your final second year placement. You might be working on this essay, the competencies you need to meet at this placement might be different from this placement. Make sure you relay all of this to your mentor, and just make sure that you play an active part in your own learning, and also make sure that you try and engage them in your own learning. It's not a case of you go to placement, hey, this is what I need to be signed off, and then that's it. No, let them know that actually, oh, there's nothing wrong with not just reflecting by yourself, but also reflecting with your mentor. Every couple of shifts, there's nothing wrong with saying like, oh, I've seen myself grow and develop in this area, however, this is an area that I'd really like to develop in. And then your mentor, not all mentors are like this, because not all mentors are made equally. When I'm saying mentor, I'm talking about the ideal mentor. Then your mentor may say, actually, yeah, I have seen you develop in this. They may ask you a couple of questions, you know, going back and forth, just trying to assess your learning. How I see it as well, I think a lot of the times, because placements for the most part are a pass or fail, a lot of student nurses think that it's going to be super easy to pass. A lot of student nurses think that merely by showing up, merely by being present, that they're going to pass. Merely by just having, you know, if it's 300 hours at this place you need to achieve, and they achieve 300 hours, a lot of them think, okay, if I just show up, do the 300 hours, and yes, of course I'm going to pass. It's not like that. And one thing that I wrote down that I want to make sure that I mention is that, let's just say, maybe some people don't give, I'm not saying this is the situation for this student nurse, because I don't know her whole situation. She only gave me like 5 or 6 sentences on what was going on. I really don't know what was going on with her situation. But sometimes, I even know from my experience as well, very early on during my nursing degree, I never gave placement the same respect that I gave theory. And when I say that, what I mean is that when it was like purely theory time, if I let's just say I did a module and it was called Relationships in Nursing Practice, and I knew at the end of the module, you know, I had to go to lectures and seminars and all that stuff, and if I knew that at the end of the module I'd have to do like a 5,000 word essay, if I had an inkling in my mind that I was going to fail this essay because I know I wasn't well during the time and I missed loads of lectures, or I just didn't really understand the content of what was being taught or what was being discussed in the seminars, best believe I'd be asking my course mates, you know, what does this mean? How does this work? I'm so confused as to this area. I'd email like the seminar lead or the lecture lead and be like, hey, can you explain this? Maybe in your next lecture, can you talk about this? I'd be on it quickly. If I had an inkling in my mind that, you know, 9-10 weeks down the line that this essay is going to be very hard for me to complete, or that I might fail it, I'd be doing all the prep beforehand. And you know, sometimes when it comes to placement, not that I ever had the feeling that I was going to fail, but if there was like a competency that I knew that might be challenging, that might be difficult for me to meet, sometimes I never put in that work. I was never to my mentor, hey, I think I might fail this competency, can we start working on this early on? Or hey, mentor, this competency is a bit tricky, can we put these action points in place to make sure that we're meeting this competency by this time, and all of that stuff. And I know that that situation doesn't just apply to me, I know it also applies to other student nurses at the time and other student nurses at present. So yeah, basically what I want to say, or what I try to say in that point, is that the same energy that you give to theory, make sure you give that same energy, make sure you apply that same energy to your placements as well. Just because it's a pass or fail doesn't mean it's an easy pass. It really doesn't mean it's an easy pass. You have to put in the work. I can think of all the essays that I've completed, not all of them, but when I'm just thinking as a whole of all the essays that I completed, the essays that I got like a 60% in, and I compare that to the essays that I got a 90% in, best believe that for the 90% I put the work in from early. I put the work in from early. The same thing has to apply for your placements. You need to put the work in from early. If you have an inkling in your mind that you might fail, be upfront with it. be upfront, because I know at some universities, if you fail a certain amount of placement, or even if you fail one placement, then that could be the end of it, or it may mean you having to retake the whole semester, or you having to retake this section of this degree, and you know, it's really not worth it. Like I said, the same energy you apply to theory, make sure you apply that same energy to placement. Be upfront with your mentor, engage with your learning, and try and make them as engaged as possible. Obviously, it's not their learning. They've already been there, done that. Their nursing school days are over, so they don't need to worry about it. But like I said, just saying, hey, I'm working on this essay, you know, just in passing conversation, rather than being like, oh my gosh, I had a night out and I was drunk, and you know, oh my gosh, it's my sister's christening tomorrow, or oh my gosh, I got a new puppy. Rather than talking about that stuff that really isn't going to help you when it comes to a placement or your nursing school journey, rather than saying that, rather than saying, oh my gosh, did you see what was on Googlebox the other day? You can say, oh my gosh, I just submitted a 3,000 word essay and I got like a 70% and I'm super happy. You know, just stuff like that will just kind of help you. Like I do want to say, like I say in most of my videos, doing that, you know, doesn't negate the need to actually put in the work, to make sure you're going to your lectures, to make sure you're engaging in your placement as well. You know, that doesn't negate the need, but it will help you in that area. Going directly back to this student nurse's situation, one, she said she felt like she was going to fail placement, and two, she said that she felt like her confidence may be having a negative impact. If you guys watched this video, I believe I titled the video, if this is you, then don't do it. And one of the things that I mentioned was confidence. And like I said in that video, I didn't mean confidence about being able to perform in front of 100 million people, and you know, confidence that you walk into a party and you're the first person dancing. I mean, if you can't act as an advocate for yourself, you cannot act as an advocate for other people. Just based on like the 6 or 7 sentences that this person sent me on Instagram, that's kind of like what I can see. She believes that she may fail her placement, but she's been unable to approach her mentor. She's been unable to act as an advocate for herself, and simply having a conversation will take you to so many places. And a lot of the times, from my experience and from what I've seen from other student nurses, it's not even about you personally. It could simply just be that the placement doesn't have the appropriate environment for you to meet said competency. I remember I had one placement and there were a handful of competencies that I didn't meet, and it wasn't down to me. Like, it wasn't because I didn't do this or I didn't do that or this was this. It wasn't down to my mentor. It was just down to the nature of the placement. There is no way I could meet X, Y, and Z competency in this placement or in this area, just because it was a thing that they never did. And if I never had, you know, these sort of conversations with my mentor early, with that particular mentor early on, come the end of the placement, I would have like failed those competencies, and it would have looked like I never put in the work, or it would have looked like me and my mentor never put in the work. And it wasn't because of that, it was just because of the nature of the competency. So when she failed me, because that's what she did, I passed the placement, but when she like failed me for those particular competencies, she literally just put a note at the bottom saying that the nature of this placement does not allow for these competencies to be met. So when, you know, the course leader or the practice supervisor or whatever came and looked at my placement and saw that I'd passed it, but saw that I'd failed certain competencies, they won't be like, oh, Marie, you didn't do this and didn't do that. They could just see it was down to the nature of the placement, and not, you know, anything lacking on my side or anything lacking on my mentor's side. I remember very early on when I was a registered nurse, there was a student nurse that I would work with regularly, and she told me, she kept telling me, oh my gosh, Maria, I think my mentor's going to fail me, I think my mentor's going to fail me. And one thing that I told her was that, you know, make sure you work with your mentor as much as you can. I appreciated that her mentor was a band 6 and was always in charge of the ward, so it was hard for her to work with her mentor. So a lot of the time she'd be working with me or, you know, any other, you know, band 5 nurse. And she'd been to all of the meetings, yeah? She'd been to all of the meetings, she'd done all the documentation, she'd done all the paperwork, and she still failed her placement, and it was her final placement. So right now, rather than her being a newly qualified nurse, right now she's working as a healthcare assistant because she failed her placement. And when I look at her situation, it came down to her confidence. And guys, confidence is so important. Confidence doesn't mean knowing everything. When I was a student nurse, even now as a registered nurse, there are so many things that I don't know, but I have the confidence to say, hey, I have no idea what this is, can you help me out? That is literally confidence. That is courage. When we think as one of the 6 C's, that's what that is. You know, a lot of people are able to recite the 6 C's and say, this is it, this is it. But can you live that life? Can you actually give examples of what it actually looks like? And this girl's particular situation is one of that. And very quickly, one way to, you know, help improve your confidence is, you know, understanding what it is you need to do. You might not understand how to do it for yourself, but understanding what you need to do. This might sound a bit harsh, but learning to put your feelings aside, because there's been times even now where, you know, I'm not confident to do it, I'm not confident to do it. At the back of my head, I know I can do it. Like, I can talk to this person, I can talk to this very senior member of staff, but I'm not confident in doing it. Why? Because I think that they're going to be rude, or maybe because I think they're not going to listen to me, because I think. Nah, put your feelings aside. Legit, put your feelings aside. You can do it. Go ahead and do it. Go ahead and talk to this person. Obviously, I'm not saying if you can't do it, then you can't do it, because there are things in my practice that I know I can't do and I won't even try doing. But when you put your feelings, for certain situations, when you put your feelings aside and you realize that, yes, actually I can do it, I don't want my feelings, I don't want my emotions to get in the way of what it is that I need to do, you'll find that there may be 1 or 2 more things that you thought you couldn't do that you can actually do. I remember when I was a student nurse, there were some placements I was fine, some placements I was so scared to talk to certain members of staff because I thought, oh, they won't respect me, they won't listen to me, they won't this. All of that was feelings. Mate, I can talk to people. Like, I know for a fact I can ask you about this, or I can discuss this with you. But because sometimes my feelings got in the way, it never happened. But when I learned to put my feelings aside and, you know, put that away and understand that actually I can do this, then I went ahead and do it. So yeah, in terms of raising your confidence, sometimes learn to put your feelings aside, understanding what it is you need to do in terms of like goal setting, understanding where it is that you need to get to, talking to yourself. Positive affirmations for some people can be very beneficial. Making sure you face your fears and do things outside of your comfort zone as well. When I say do things out of your comfort zone, I don't just mean it in relation to nursing practice, but just in relation to other stuff. Like, let's just say, for example, you like to run. When I was at uni, I like to run a lot. I don't run anymore, but when I was at uni, I liked to run a lot. And I was thinking, okay, instead of running 5 miles a day, I'm gonna push myself and I'm gonna run at 6 miles straight. And I ran at 6 miles straight. I pushed myself out of my comfort zone. And that skill, that ability, I was able to translate that into other areas of my life, one of them being, you know, nursing school. So whereas in the past I would never have called the consultant because I was too scared, I knew at the back of my mind, like, mate, last week you ran an extra mile. You were able to run an extra mile because you knew you could do it. You push yourself, you had the motivation, you had the preparation. You're able to translate that into other areas of your life. I think of like one of the volunteering things that I used to do. I used to interview people all the time, and I'd have to come back to the team and relay my thoughts and opinions on whether I thought this person should pass or whether I thought this person should fail. And I was able to translate those skills into my nursing practice. So when I say push yourself out of your comfort zone, I don't just mean it in relation to nursing, I mean it in relation to other areas of your life. And surely enough, a lot of that will trickle down into the nursing aspects, and you'll find yourself doing stuff like, oh, where did I learn to do that? Oh, I never knew I could do that. It's because you were doing it from time in other areas of your life. So yeah, like I said, the advice that I would give to this person is be upfront. Ask, you know, the 2 questions or the 3 questions with your mentors. Make sure you document everything. Make sure you have relevant action plans that you can work on. Make sure you engage with your learning, and also try and engage your mentor in your learning. And make sure you have regular meetings and you set the expectation early on. Because what I found in my nursing practice, when it came to like the paperwork side of things, a lot of my mentors did not know. They didn't have the slightest clue what they were doing. When it came to the paperwork, in terms of we need to have meetings on this day, this day, and this day, they had no idea what they were doing. And it wasn't because they didn't know how to do it. It was just because they needed reminders that, hey, Jude, in 3 weeks time, we're going to have this meeting. Can you make sure you put this in your diary? And one thing I learned, it wasn't even a case of asking. It was a case of telling. It was a case of telling, because this stuff has to be done. You need to have regular meetings with your mentors. This stuff has to be done. It wasn't a case of, hey, Jude, can we make sure we have a midpoint meeting? It was a case of pulling up with your diary, pulling up with your phone and saying, Jude, when are you next free? We need to have a meeting approximately midway in between. Can you tell me what day you're in? I'll make sure. I'll tell the ward manager, let the ward manager allocate like half an hour out of her shift so that we can do that. And make sure you do that. Make sure you act as an advocate. Don't be like, oh, mentor, we need to have a meeting in 3 weeks time, and then just leave it at that. No, because understand that your mentor still has their nursing role that they need to do. Their patients come first before anything else. Their patients come first before any student nurse. So yeah, those are the tips and advice that I would give to someone who thinks that they're going to fail their mentor. Also, make sure you inform your placement supervisor or your placement link. I know some universities describe it as a placement link. And just, yeah, involve the relevant people, have the relevant conversations, make the action points, and, you know, regularly check up on the action points and reflect on yourself. And don't wait till you're in the position that you think you're going to fail before you start doing this. Because luckily I never found myself in a position where I thought I was going to fail. Luckily, me and a lot of my colleagues never found ourselves in a position where we thought we were going to fail, just because we put the relevant points in place. It has nothing, a lot of the times it has nothing to do with you being a bad student in terms of the fact that you're lazy or you're not smart enough. It could just be because, you know, you're going with the flow. Like, only dead fish go with the flow. I hope this video was helpful for you. If you guys do have any nursing dilemmas, then make sure you like message me on Instagram. I do be honest, right now I'm not really on Instagram like that, but you can submit your nursing dilemmas there, or you can simply put your nursing dilemmas in the comments box below. Anyway, thank you guys for watching, and I'll see you guys in my next video. Bye.